First at 10, nurses say they're just being stretched too thin and they're worried it's compromising patient care.
It's a problem that may only get worse as the spread of COVID-19 continues. Here in Kansas City, our 7-county metro reported 958 new cases today. The total of cases all time, more than 77,000.
For those on the front line, they are calling for more protection to stay healthy.
41 Action News reporter Andres Gutierrez shares the problem some local nurses say they experience on a daily basis.
Tonight, nurses from Menorah and Research Medical Centers gathered outside their employers' headquarters calling for more PPE and help while on the front lines in the battle against COVID.
It's behaviors that research has put into practice since COVID started that has led us to this position.
In her 28 years as a nurse at Research Medical Center, Cheryl Rodarmel didn't think she'd have to protest to get the tools to protect herself while on the job.
Under normal circumstances, we would be removing our mask and throwing it away every time we left the room. They're now telling us and have told us from the very beginning, you have to wear one for the full shift. If it gets soiled or wet, you could go down and get a second one. But then when you go down to get it, the monitors for the PPE room tell us no, they won't give that.
We don't have enough of it. We're reusing masks when we shouldn't be. We're using N95s much longer than what the manufacturer has made those supplies to last.
These nurses' concerns over PPE within HCA Midwest health hospitals have come up since the onset of the pandemic. And since then, nurses say staffing levels have also taken a toll.
There are some staffing grids where nurses are taking 6 or more patients apiece, and it's just too many.
But some of their colleagues believe the healthcare system is doing enough.
Just, reach out to your managers, your directors. If you need something, don't hesitate to ask, because we do have the support and backing of our administration and hospitals.
In a statement, HCA Midwest Health said in part, throughout our response to COVID-19, our focus has been on protecting our colleagues and ensuring our people have enough personal protective equipment. This includes our universal masking policy consistent with CDC guidelines. They've also brought in volunteer nurses from their sister hospital in New Orleans to help locally.
You should do the most that you can to protect your frontline workers.
In Overland Park, Andres Gutierrez, 41 Action News.
We did reach out to the Missouri Hospital Association about staffing and equipment needs for nurses and doctors across the state. They told 41 Action News virtually every hospital in the state is addressing a staffing shortage as nurses and other health professionals who live in the communities they serve risk infection, isolation, or quarantine. Hospitals and healthcare workers need the public's help in driving down the transmission of the virus, because that's the only effective tool to manage the surge in hospitalizations we've been seeing in the past month.